Hello and welcome to the Sisters for Fitness Wellness Show. I'm Stephanie Gaines-Bryant. Our guest today is Dr. Tiffany Schatz, and she's with Doctors Community Hospital. She's a thoracic surgeon, and today we're going to talk about lung disease. Now, there have been a lot of positive developments when it comes to lung disease over the last 20 years. And one of the developments is in the area of screening.
That's right.
How has the screening gotten better over the past few years?
Well, in the past 10 years, they have performed a huge research study which showed that lung cancer screening with a low-dose CT scan can decrease your risk of dying from cancer by 20%, which is actually higher than mammography and pap smears and colonoscopy for those other kind of cancers, which are pretty established already in medical care. The reason that the mortality is decreased is because we're finding the cancers earlier and we have a better chance of cure from lung cancer.
At what point should you be screened? If you've smoked for 5 years, 10 years, 15 years, at what point should you say, hey, I may need to look at getting screened?
So screening is approved for anybody over 55 to 75 or 80 who has smoked for a total of 30 pack years. 30 pack years basically means a pack per day for 30 years or 2 packs per day for 15 years, something like that. It's an equation. And anybody in that category should be screened and can be screened with Medicaid, Medicare, and insurance all covering those CT scans. Some other people may benefit from screening, people with family history and also some smoking history, but those may or may not be covered by insurance.
If you quit smoking, how long is it before your lungs, I don't know if your lungs ever look normal, but how long is it before you don't need screening anymore? You're considered a non-smoker?
It's about 15 years. So if you have quit smoking in the past 15 years, then you should still go ahead and undergo screening.
Why? Is there, it stays in your system? How does that work?
Well, lung cancer and cancer in general has to do with the exposure to the carcinogen, which is a toxin that causes a mutation or a change in the DNA of your cells. And so the cancer develops over time and usually many years. And usually there's multiple insults to the DNA, which eventually lead to cancer. So if you are smoking for many years, you're basically insulting your DNA over and over and over again. And the chance of the cancer developing is greater and greater over time.
I've been seeing a lot recently, it's more younger folks smoking. I've seen more in the last few years than ever before. And I'm wondering if people aren't getting the message that smoking is bad for you. They put out that message years ago and now it seems like it's forgotten to a certain degree.
I don't understand the reason people decide to smoke, except that it's still promoted in the media. In movies and shows, there's still a lot of characters that smoke and it's glamorous. Also, smoking does help people feel decreased appetite. So if they struggle with weight gain, sometimes they'll choose to smoke instead. Essentially, people who have a lot of their community also smokes. It's very difficult to stop smoking. So once you start smoking, you need a lot of support to quit. And so the first thing is to not smoke, to educate your kids that smoking is really one of the worst things you can do for your health long-term, for your entire life. And then also, when you decide to smoke, when you decide to quit smoking, that you partner with your loved ones and do it together and get all the support that you need. We do have a class ed doctors to help, a support group basically, to help go through that process because it's very difficult.
It is very, I smoked for a lot of years and I quit, it's been 18 years ago.
Congratulations.
So I definitely understand how difficult it is to quit smoking. If you are a smoker and you do get screened, there are stages to lung cancer. What are those stages?
So stages 1 through 4, initially when we get the low-dose CT scan, we'll see a nodule or a mass, which is basically a growth in the lungs, which help us to decide whether we need to do a biopsy or follow it. Lower stage disease, like stage 1, is a small nodule or a small mass in the lung, which is contained within the lung. Stage 2 is larger and involves more of the lung. Stage 3 actually has spread to the lymph nodes in the middle of the chest. And stage 4 has spread outside the lungs or the chest cavity to other organs like the brain or the liver. Essentially, the first step is to identify the mass and do a biopsy so that we can see exactly what is that nodule made of. Is it lung cancer? And once we've determined that it is lung cancer, then we do the staging, and that involves several tests to identify, has it spread anywhere else? And if not, then we can go ahead with treatments which are mainly surgical to remove that cancer from the body.
So it's best, of course, to either be at stage 1 or 2.
That's correct. Stage 1 or 2 can be treated mainly surgically, and after that, the patient doesn't need any more treatment. Stage 3 is one where you need chemotherapy and radiation to try to get all of the basically the cancer tissue out of the lymph nodes using chemotherapy and radiation. And that can happen before or after surgery, depending on how far it's spread.
When we talk about the testing, the screening, is it invasive?
It's not. It's a low-dose CT scan. It's basically the donut, not the MRI, which is the long tube.
Yes.
Everybody hates that.
Yes.
But
Paranoia, help me.
I know, the claustrophobia. So it's the tube. It takes about 5 minutes, and your primary care doctor can order it. It is covered by insurance, and it's something that we can repeat over several years. If we find something that doesn't look concerning, we can continue to follow it, and if it changes, we can then intervene early.
What is life like after you've gone through the treatment for stage 1 or stage 2? Is there a good likelihood that the cancer will return? Or how do you begin living a healthier life after the cancer?
Right. So after lung cancer surgery, which we are able to provide minimally invasively with the small incisions, most of life is pretty normal. You essentially should be able to breathe well and go about your daily activities with no significant changes. So at that point, we do recommend a healthy life, which includes quitting smoking, exercise to keep your heart and lungs strong, and a healthy diet to keep yourself well nourished and strong and active. Essentially, those are the main things to stay healthy for anyone. And so it's the same recommendation. Not smoking is the biggest thing. Especially if you've had a history of lung cancer, your risk of having another lung cancer is quite high. So preventing that by quitting smoking is really important.
And you also mentioned that in stage 1 surgery is the best solution. Nowadays you are working with robots with the surgery. Can you tell us about that?
At Doctors we have the Da Vinci robot. It's the only robot in the county, and we're able to provide this minimally invasive surgery, which is very advanced. Where robotic surgery includes a large, very advanced robot which has multiple arms. I'm able to place the arms into the belly through small incisions, and these arms have small wristed instruments at the end, kind of like my hands. And so through a console which is next to the robot, I'm able to dissect the tissues or move the tissues around and remove the problem tissue, the cancer, out very delicately with minimal complications, and it really shortens a hospital stay and allows patients to get back to their life earlier, as well as if they need further treatments like chemotherapy and radiation, they should be able to go on with them sooner because their surgery is more smooth with less complications, shorter hospital stay, and less pain.
So the robots, in other words, are more efficient because of the smaller hands.
Right,
and
more delicate.
And they're able to do more manipulation.
It's really remarkable to see patients improve significantly. We've had some surgeries that are both lung as well as other mediastinal, which means the middle of the chest, tumors removed, where patients are ready to go home the next day or 2 days later with really no complaints and feeling well. And even I am amazed, you know, how well they do. So
we talked about stage 1 and 2. Once you get to stages 3 and 4, it's no longer automatically a death sentence anymore.
no. In fact, we have a lot of new chemotherapy and medical therapies that help to decrease the cancer, which are very exciting and have made major strides even in the last 5 to 10 years for lung cancer. And those work together with surgery to decrease the risk of cancer coming back, as well as increase the chance of cure from the lung cancer. So when you're talking about stage 3 lung cancer, that's when it's spread to the lymph nodes in the middle of the chest. If you can have cancer, if you can have surgery first, which means that you take the lung tissue and the lymph nodes out, and then have chemotherapy and radiation, that's a lower stage and a better chance of cure. If it's a stage 3 that's spread to the other side of the chest from where the cancer is, then you can have chemotherapy and radiation only, but that still has some chance of cure. The risk of it coming back is much higher, though.
And how about with stage 4?
Stage 4 is where it's spread outside the lungs and the chest cavity. And that is something we don't talk about the cancer being cured, but we do treat it with chemotherapy. And like I said, we have much improved chemotherapies that are much more effective to decrease the volume of the cancer and give the patient a much longer life expectancy with a better quality of life. Essentially, what we want to do with stage 4 is to keep the patient, the person at home with their family and have
That's
as
so
many
important.
good days with their family as possible. And the thing to remember is that every person's cancer is different. Even though we have, you know, lung cancer is different from colon cancer and so forth, each individual person's cancer responds differently to some of these chemotherapies and radiation. So one person may have a really great response and almost the cancer disappear, whereas another person may have a very aggressive tumor. But we have several tests that help us to know if the patient's cancer is going to respond to those chemotherapies, and we only really know once they're receiving the treatments. So sometimes people need multiple different types of treatments, and sometimes we try experimental treatments, but the horizons are looking good in general.
What symptoms should you look for besides the fact that you're a smoker?
Right.
What are the symptoms, and has that been the problem in the past, is that there aren't a lot of symptoms that people can actually go to and say, okay, I've been coughing a lot? Or
Well, really early lung cancer may not have any symptoms, and that's why we have the screening programs. But later, as it continues to develop, cough is a major symptom, shortness of breath, coughing up a lot of sputum or blood even, and sometimes having a pneumonia that doesn't go away, where you're treated with antibiotics and still there's a pneumonia there. Sometimes there's a mass in the airway that is preventing the pneumonia from resolving. Other problems like hoarseness or pain are later symptoms that show that the cancer is sort of invading to the surrounding structures.
so because now we have this screening, what has been the success rate?
Well, it does decrease the risk of dying from lung cancer by 20%, which is really quite high. It's higher than the other screening programs by far. And so as far as the number of people who are treated for lung cancer and who are cured, it's much higher.
We've got other ways that people are smoking nowadays, not just cigarettes. People are smoking cigars. That's very fashionable. People are doing the whole vaping thing. How dangerous is that? And have you seen that connection between those things and lung disease?
Certainly cigar smoking, marijuana smoking, these things are not good for your lungs. Vaping is also not good, but I don't think we have any data to connect vaping and lung cancer. But I would say any things that you're inhaling that don't belong in your body have a risk of hurting your lungs or your other tissues. So finding a way to take those out of your lifestyle I think is really important to maintain a healthy life and the longest life that you can have.
And you don't want a situation where we find out 10 or 20 years later, hey, this is really dangerous, you know, and right now we don't have the data, but it's coming, I'm sure.
Right. And anytime we've had these fashionable substance uses, I mean, people used to use morphine and these kind of things, which turned out to be very addictive and very problematic. It's the same type of thing, anything that you ingest, especially into your lungs, which are very sensitive. Fortunately, we've heard that coffee has some benefits, so I'm going to keep drinking coffee.
Well, let's talk about some other chest diseases. What about mesothelioma? What is that? I've been seeing lots of commercials.
There's a lot of commercials. So mesothelioma is a rare chest tumor. It affects the lining around the lungs inside the chest. And it comes from exposure to asbestos, and it's usually a long distant exposure, about 30 years or more prior.
So you can, for example, if you were exposed at the age of 6, 30 years later, you may discover that you have this condition?
Right. It is possible that young people can develop mesothelioma. It's very rare, but if they've had an exposure, especially a significant one, I've seen patients in their late or mid-30s whose parent was involved with asbestos, who developed mesothelioma. So that is kind of a sad story. But there have been people exposed to asbestos through the years because of the Navy, because of the building construction, and in homes.
Like, for example, if you work in an environment where you're
environmental.
Where you're exposed, then, so most likely the patient is older.
Usually. Older and had an exposure many years ago, and usually a significant exposure. Most of the time with cancer, it's not a one-touch phenomenon where you one time were exposed to something and suddenly you have a horrible cancer. It's usually multiple insults, like we talked about with smoking, over time, which lead to the development of the cancer. Mesothelioma is very aggressive, and even though it can be treated, the surgical treatment is very aggressive, and the medical therapies are sort of the main treatments just to keep it at bay. Typically, it's not cured because it usually presents quite late.
We were talking, you were just mentioning cancers that are aggressive. Lung cancer is one of the deadliest.
It is. It's the top killer of men and women in this country from cancer.
Is it more men, or is pretty even?
It is becoming more evenly distributed. It used to be much more men because of smoking was much more common in men in the past. Yes. Now it's more common for women to smoke, and the incidence of lung cancer in women has more equalized with men, although it's still more common in men.
It's interesting you mentioned earlier about the fact that sometimes a lot of women smoke because it's a way to curb your appetite. And that is, so you've got two things going against you. You're overweight and you're smoking.
Right.
Those are two of the deadliest things you could
Right.
possibly do.
Absolutely. Those overweight and smoking are probably our biggest public health problems now in our country, unfortunately.
So what can you say about getting the word out about not doing this?
About not smoking?
Yeah, about not smoking, whether it's for weight loss purposes, whether it's to curb stress. It is
Right.
just not a path you want to cross medically. Do you
Right.
want to go through? And they've also got a lot of commercials on TV showing how devastating smoking
Right.
can be. People who have gone through different surgeries or whatever, and what their life like is as a result of this.
Right. Absolutely. And it can be devastating. The worst thing is to die from a cancer, lung cancer, you know, other mouth and neck cancers. I think the main thing is that you have to, number one, acknowledge and agree with the fact that you don't want to do it. You don't want to be a smoker anymore. Even as hard as it is, you want to decide to quit smoking. And then the next thing is to get support. Get support from your primary care doctor and get support from family and friends. Join a support group. We have one at Doctors Community. Basically, most people can't do it alone. Sometimes medications help.
What's out here now as far as medications?
There are multiple medications. Everybody has a different type of medication that they like more. There are gums, lozenges, patches, pills, things that help with the mood and stress. As far as you know, the reason why you're smoking is often the stress and so forth. So
you know what's so interesting? People complain about the gum is gross, but it's worth it. Would you rather have lung cancer?
Right. Right.
Then just go through whatever you need to. I quit cold turkey, which was horrible.
Congratulations.
But if you've got these things that can assist you, the gums, the patches, the lozenges,
Right.
and support groups.
Right. And I had one patient who said, you know what, I just have such a habit of having something in my hand and in my mouth that I started taking lollipops. Just have something there. And even though there's no medication in it, it just was that thing that helped to ease the desire. So I think talking to your doctor and also rallying your support team around you, your family and your friends, especially the people you're living with who may also be smokers, makes it so much better to quit smoking if the people around you also can try and quit.
And aren't there dangers, even if you don't smoke inside the house and you go outside to smoke, or even at the job? There are a lot of people who will stand outside and it's like 10 degrees below zero, but they have to go outside and get a smoke. And you're still, you know, when you come, you're opening the door and you just smoked, the smoke can still be traveling in your house,
Right.
exposing your kids, exposing
Right.
the family you love so much.
Right, right. And other things too, I mean, the little things, your taste and smell are better when you quit smoking. You smell better. You're a better example for your kids to not be smoking.
And when we talked about living with cancer stage 1 and 2, what's the process for going on when you have survived 3 and 4? What should your lifestyle be like?
Well, typically, once again, if we do surgery, then you should still be able to live an active life. You, most of the time, will not require oxygen or any significant limitations. The main thing is to continue being as active as possible. Doing that aerobic exercise that's good for your heart and lungs. Once again, quitting smoking, having a healthy diet, and continuing to follow up with your doctors. Because once you have any stage of the disease, we regularly follow you to see where is the tumor, especially with stage 4. We're going to see, is it spreading, is it staying put? But in the lower stages where we believe we've gotten it all out, we've tried to kill it all, then we continue to follow you every few months, and then after time every year to evaluate, did it come back? Where might it be? Do you require more treatment? And I think for patients to stay connected with their medical team. At Doctors, we have a multidisciplinary tumor board, which means that all of the different specialties come together and discuss the care of the cancer patients. So you have the medical oncologist, the radiation oncologist, the surgeon coming together and discussing what is the best treatment. And so over time, if that cancer were to rear back up, then we can discuss, what are the options and how can we best treat you.
Dr. Schatz, we mentioned at the beginning of the program when someone should consider getting screened. Let's mention that again.
Right. So screening anybody over 55 who's had more than 30 pack years of smoking, and 30 pack years means 30 years of 1 pack per day, or 60 years of a half a pack per day, 15 years, 2 packs per day. People who have smoked heavily for many years are usually within that category.
And as we mentioned earlier as well, the screening is non-invasive. It's not like they're going to be sticking lots of needles in you.
You don't go to sleep. You don't have to do a prep. There's no special medications. There's no special reactions. It's just a CT scan, takes about 5 minutes, and you're done.
And also, is it a long period of time before the results are read? Is it something that you have to wait on for?
It's usually a day or two, and you can follow up with your doctor to have the radiologist read as soon as it's done. And
that's also very powerful to know that there are a team of doctors working on little old you.
That's right.
You know what I mean? There's a whole group of people who are interested in your care.
Right, and who have trained in different fields, so they bring a massive expertise from their field in medicine to make sure that we don't miss anything and that we do all of the things that might benefit you.
Thank you. Is there any other thing you'd like to, as we wrap up the show, any other message you would like to emphasize before we go?
Well, I'm so happy to be here. I really appreciate you having me on. And I'm so pleased to be working here at Doctors Community. I'm relatively new to the community, and so far I've just been so blessed by my patients and being a part of this team.
Thank you. Thank you so much.
Pleasure.
We've been talking to Dr. Tiffany Schatz, and she is a thoracic surgeon at Doctors Community Hospital. We've been trying to get that message out there about getting screened for lung cancer. Let's stay healthy.
Thank you.
You've been watching the Sisters for Fitness Wellness Show. I'm Stephanie Gaines-Bryant. Have a great day.